Queen Margaret University. As I said, I'm Richard Butt. I'm the Deputy Principal of the University, and essentially means I'm in charge of the sort of the academic side of the university itself, and the two schools. I'm joined today by Dr. Jessica Lindhoff, who's our Head of Student Services, and she'll be talking to you about the range of support services that we have for you during your time here, and by our Student Union President and Vice President, Chiara and Andy, who again will talk about the kind of the range of services that the Student Union offers to you. I'll start out. I mean, my talk, you'll understand, will be slightly different from the usual one, given the circumstances that we're in this year. So primarily, I'll be sort of focusing on the kind of context for learning and teaching over this semester, the Scottish Government guidance and the implications for your learning and teaching and the adaptations that we've made. And what we'll do is we'll leave plenty of time for any kind of questions and answers that you may have at the end of this. So as I say, very, very warm welcome to the university. Those of you who are already in Edinburgh, welcome to Edinburgh. Some of you may already be in the kind of halls of residence, which is fantastic. It's not. I mean, it's fair to say it's not the start to 2021 that any of us really would have hoped for. But nonetheless, we are absolutely determined, as we were last semester, and as I think we sort of achieved last semester, to still nonetheless offer you a kind of great sort of educational experience. What I'll do is I'll touch on, because clearly there's a lot in the national press and the international press and the kind of Scottish press over the kind of the current restrictions. So it's really just to talk about what that means for you first of all. You'll be aware that the Scottish Government from the 5th of January introduced a kind of sort of effectively a sort of stay-at-home order in which we're only to leave home for essential purposes, and this is just to reassure you that as the situation has been really since the summer, education remains an essential purpose. So you are absolutely permitted to come to the university, to attend the university, to travel to the university, from outside the UK, from within the UK, for in-person learning and teaching. The university campus remains open. I mean, it never. University campuses don't really tend to close. We didn't close even with the lockdown back in March, because we have sort of students in the halls of residence and sort of essential services that need to continue. And we operated, as I said, very successfully last semester with a kind of a sort of blended learning approach. So that mix of kind of sort of in-person, face-to-face teaching and online sort of delivery, both using this sort of format for collaborative sessions, but also recorded lectures, which students can access at any point. And I'll kind of come back to that. But the key message for you is that the university campus remains open and will continue to remain open for those who are attending. And our core face-to-face services to students and staff remain in place. So the halls of residence, as I say, are open and have always been open, and the accommodation office remains open to support you. We continue to have catering because we're currently, all of mainland Scotland is currently in sort of, level 4 of the Scottish Government restrictions. That catering can only be offered on a kind of takeaway basis while we're in level 4. But if and when the level moves down, they'll then be, we're able to offer kind of, sort of seated catering as well. But catering will always and will continue to be available to you. The library, sometimes referred to as the kind of the Learning Resource Centre, because it's more than just a library, also remains open again because we're in level 4. It's open as a place where you can go and study and work. There's for those postgrads amongst you, and I know the majority of you on this call today are postgraduates. There is a sort of there's a dedicated sort of large sort of postgraduate space. Because we're in level 4, you can only sort of take books out on a click and collect basis. So you have to sort of kind of book them and collect them. But many of the books and journals are available online, as usual. But that's just, again, we're sort of operating under the government guidance, and there's particular guidance for libraries. But as a space, as I say, it remains open. As numbers go up, we'll probably have to kind of, make it available on a book that space available on a bookable basis. But at no point last semester was there an issue with us reaching kind of capacity. The Learning Resource Centre occupies a large proportion of the university space, so there's plenty of space there. Student services, again, Jessica will talk more about that, but they are also, as you'd expect, open to students to access, both a mix of face-to-face and online. Other services are available online. Our IT support and our effective learning service are both available for online support too. A couple of other kind of key messages. Asymptomatic testing, you'll be aware that universities throughout the UK have been sort of tested students using the lateral flow testing system on when they left university at the end of the sort of last calendar year, just before Christmas, and are offering testing to students for their return. This is entirely voluntary. You're not obliged to take it, but it is strongly encouraged both by ourselves, by the kind of the medical research, and by the Scottish Government. And our on-campus testing kind of clinic opened today, so today's the first day of its operation. I think it'll be opening sort of 2 or 3 days a week in the first few weeks, given the kind of the relatively low volumes of students we'll have in the first few weeks, but that will increase. It's pretty quick and easy, only takes about sort of 10 to 15 minutes. It's self-administered. Some of you might be sort of familiar with this already. And if you go to you'll see from the university website, there's a kind of a link that will take you through both to the booking system and to a sort of short video that explains the delightful procedure of how to kind of successfully stick a swab down your throat and up your nose. I know. Delightful thing to be talking about of a morning, but we recommend kind of that you take 2 tests, sort of 3 days, usually days apart. As I say, the results are texted to you usually pretty quickly within the whole thing's pretty much done and dusted within 15 minutes in terms of the test itself, and the results are with you very quickly too. And again, just to reassure students travelling to the university from outside the UK, you can contribute if you've not already travelled. You can travel to your term time accommodation as planned. Obviously, as for anyone travelling from abroad, there are international travel and quarantine requirements. The standard sort of 10 days that you need to sort of quarantine yourself for. But if you've got any questions, then the international team, who I know many of you have already had kind of quite regular sessions with, will be pleased to sort of help with any queries that you have. A bit about the kind of the impact of the current restrictions, the restrictions kind of introduced from the 5th of January on our teaching and learning. For many of you, there's actually little impact. The Scottish Government have been clear that any teaching that was scheduled to take place on campus, and for the majority of you, that is you, then any required changes to delivery, will be kept to an absolute minimum, and your kind of program leaders will sort of notify you if there are any. So for the overwhelming majority of you, there are no substantive changes to what we had already planned. And that's kind of sort of permitted under the Scottish Government guidance. We have some teaching that was due to begin on campus after the 25th of January, and the Scottish Government have advised that students in that position should expect their return to be delayed. They say hopefully by a minimum. As I say, that will apply to very few, if any, of you. So you don't need to worry about that. But it will mean, I mention it here because it will mean that the volumes of students on campus will be significantly lower than they would normally be. But it does mean if you're in the unlikely event that you're in that category, and we can come back to that later if you're unsure, then the advice is to hold off from booking your travel at the moment. But the vast majority of people on the call are kind of sort of postgraduate health students. I know there may be some sort of international exchange and Erasmus students too. And for the vast majority of you, the thing, if you were scheduled to begin before the 20th of January, some of you will already have started, and there are no significant changes. Nonetheless, though, we do have some students who might be shielding or unable to attend in person, and will facilitate making your study available online to you. If you're in that position, if you thought you were going to be sort of, coming onto campus, but you now feel that you won't be able to, and that you're expected to be on campus, then please contact registry to let them know. You've got the kind of email address there. It's just registry@qmu.ac.uk. The exception to being able to kind of, to offer you your studies online are the pre-registration postgraduate healthcare students, which is the majority of you. You do need to start your mandatory pre-placement in-person sessions, if you have mandatory pre-placement in-person sessions, by the 25th of January in order to allow us to for you to get through the entire sort of training before placements. So that's only for those of you who were due to have pre-placement kind of in-person sort of training. Everyone else, we are able to facilitate you studying entirely online if you're unable to attend the campus. I'll talk more generally about the kind of adaptations we made from last semester and which still apply this semester in terms of learning and teaching. As I've already indicated, teaching is a kind of a blend of in-person and online delivery. And at the moment, over these few weeks, the in-person delivery is primarily for activity where that's essential, and that's typically the healthcare programs and our kind of sort of more kind of creative subjects like costume, acting, and film. But the blend last semester, we had this sort of blend of in-person and online. So in-person for sort of face-to-face sort of tutorial, practical sessions, studio work, etc., and some of the kind of specialist lab work that you'd expect to have with if you're studying, say, human biology, radiography, etc., etc. Supported by online, both sessions like this, so sort of synchronous online discussion sessions, but also asynchronous recorded lectures using our kind of Panopto software. The teaching spaces, as you can see in the diagram there, have been set out to ensure 2 meter physical distancing. So that consequently means that in the majority of the classrooms, there's no more than 9 students plus a member of staff. In larger spaces, and for some of you in spaces like the sports hall, you'll be in sort of full PPE for the more kind of practical sessions. We do ask you to, you'll see when you go into any of the classrooms, there's a sort of square box that where you can kind of swipe your card, your matriculation card when you get it, which will look a bit like that. And that just simply means that it helps us with any kind of required track and trace. I should say we as far as we are aware from from Health Protection Scotland, we have no cases of sort of students contracting kind of COVID-19 through in the teaching spaces. The sort of 2 meter physical distancing and the kind of face coverings in sort of outside the spaces has meant that they were very sort of secure from a COVID point of view. But nonetheless, it's helpful if you could swipe in just in case. And because, again, we're at level 4, then unlike last semester when we were at level 3 and then in level 2 here in East Lothian, face coverings are currently required in classrooms and all communal spaces on campus. We'll let you know, sort of if and when that changes, we'll let you know and what that means for you. But it does mean that at the moment, kind of face covering is mandatory in sort of effectively in all spaces. A few things that we're kind of obliged to kind of go through with you that you'll be very familiar with just from a kind of sort of Scottish Government point of view. If you do have symptoms of coronavirus or someone that you live with does, then please stay at home and contact the main reception. You can access them just sort of by dialing the main sort of university number, or if you're in the halls, you just dial 0. And then there's a kind of absence form that we'd ask you to complete via the student portal, but you don't need to worry about those. But kind of probably most importantly, tell your program leader. We provide regular updates for students that kind of remind you of these things. You'll have seen if you come into campus, we do have a sort of a temperature scanner when you come in. You don't have to stop. You just sort of walk through there, just sort of checks your temperature as you pass. And we are also encouraged to remind you of Scotland's facts in terms of kind of COVID. face coverings, as I suggested, avoid crowded places. That won't be a problem on campus. Clean your hands regularly. You'll find there's plenty of sort of hand gel around the building when you're in, and maintain 2 meter physical distancing. And obviously, as I just said, self-isolate and book a test if you do have symptoms. So that's really it for me at this point. As I say, I'll kind of sort of stay in this session for any kind of questions that you may have once Jessica and Andy and Chiara have had the opportunity to talk to you about student services and the student union. It's no doubt that these are difficult times, but we're delighted you're here. We kind of operated very successfully and very safely last semester, and we're kind of absolutely confident that will continue to be the case this semester. So welcome again, and look forward to meeting you in due course. Thanks very much, and over to Jessica.
Great, thank you very much, Richard. Can everybody hear me? If somebody could just do a heads up. I assume that's fine. Oh, thank you, Nick. That's brilliant, thank you. I'm just going to talk a little bit about student services. So in terms of student services, we are, as Richard said, we are on campus, we're back, and we have services open each day. We're not in this week, but we'll be in from next week and onwards. And for starters, our reception is open from 10 to 2. So I'm just going to run through some of the services we have and tell you a little bit about how to access them. So under student services, we have wellbeing counselling, and you can access that through making an appointment, either just by emailing them or through what we have, Student Central, which is where we do all our appointments with any of the student services. So you could use that. So check out Student Central if you can. If you can't get into Student Central, do send us an email, and we can make sure that has happened for you, because we had a little bit of issues with that the last couple of days. But just let us know when we can help you with that. So in terms of wellbeing and counselling, obviously supports your emotional and mental health, and as well as your physical health. So we have 3 counsellors who are providing a variety of counselling therapies, from art therapy through to sort of more traditional forms of counselling. We also have a wellbeing officer who has a little bit of a wider remit in terms of looking at, she's also mentioned stay on course. So if you are finding you sort of slipping behind and you need some help with that, Louise, who's a wellbeing officer, will help with that. To provide support for anxiety, low mood, stress, sexual violence, relationship worries, addictions, etc. And I think what I would like to urge you to do is to come to us early on. If you are struggling, if you are feeling low, if you're feeling lonely, if you're feeling that you're not coping, let us know and come and have a chat with us. And we will help you to see what services will work best for you. I think for some people feel it's a bit sort of frightening to maybe access counselling, but I think it's definitely worth having a go if you are feeling a bit low or are struggling a little bit. Just come and talk to us and we can make sure we're finding the right service for you. In terms of stay on course, as I said before, that is part of Louise, our wellbeing officer's remit, and she will sort of help with that. So she will facilitate some of the contact between you and your program, etc., and support in terms of looking at what support you need in order to get back on track with your studies, etc. Right. We also have the disability service that also sits under student services. So if you do have a disability, please get in touch with us if you haven't already done so. I believe that most of you probably have, because I think we have been in touch with most people earlier on. But if you haven't, do get in touch. We provide information, support and guidance to students with disabilities. We do needs assessment to establish students' needs and suitable adaptations for disabled students. And we also do individual learning plans detailing the support you can have. And in terms of what we then categorize as a disability, it can then be anything sort of from physical disability through to other things like dyslexia, dyscalculia, dyspraxia, etc. So if you are needing some of those supports, do come and talk to us. Again, it's really good to come and do it early on. We can do an assessment. We can see what suitable support are available to you. We also do provide mental health support through the disability service. So if that is something that's kind of you think you might need as well, we can look at that. And that's done between disability service and the wellbeing service. We're kind of working in partnership in terms of issues around mental health. But do come and see us. And even if you're not sure, just come and have a chat and just make an appointment. Again, you can make an appointment through Student Central or by emailing the service directly. Student Funding Service. So the Student Funding Service provides guidance and advice to students about what funding is available to them. We have support for students who are struggling financially and in financial hardship. And we are also providing support for students with registered childcare costs. So that might be something quite important for those who have children or have potentially are struggling with childcare costs as part of kind of doing your studies as well. We also have currently a support program for students facing digital poverty or who struggle to have the IT that they need. So what we do have in place at the moment is for those students who qualify for the scheme, and it's always worth asking if you don't have a computer, you can get a laptop through us if you are sort of fulfilling criteria. So yes, check into that. There is some information on the website, and there's some information. There's an application form on Student Central as well. Otherwise, just email the service and they can find that for you. Careers and employability. Again, that's one of the services sitting under Student Services. And again, I would urge you to actually get in touch with careers and employability early. A lot of students don't necessarily think about getting in touch with careers until towards the end of their studies, but I do think it's worth doing that quite early on because there's definitely things that they can support you with in terms of looking at what your longer term plans are. They do usual career advice. They have a jobs fair. I think they're doing another jobs fair coming up, I think, in February time as a plan. They do information about existing jobs out there, how to develop the skills. They help with work experience and volunteering, employer mentoring, and they do things like CV checks and application checks so they can help you with all of that. And they're doing a lot of webinars at the moment on a variety of different things, from interview skills through to sort of how to write your CV and etc. So I do think it would be really good to get in touch with them because they are quite happy to sort of, they're really keen to work with you from early on and looking at how you can actually look at your career plan and what it is you want to get to and what things you can sort of assemble on your way through your courses in terms of making sure that when you do finish, that you have sort of an idea where you want to go and how to get there. Again, you can book through them through Student Central or through an email. For those of you who have moved here, you would need to register with a GP. And our local practice that students are asked to register with if they're living in Musselburgh is the Riverside practice. If you live in Edinburgh, you just need to look at where your closest practice is, and that blue link at the bottom, the NHS Inform link, will show you where your closest GP practice is. But if you are living on campus or if you are in Musselburgh, then it's the Riverside practice, and you could register online with them by following the link on the slide. We also have some registration forms in the reception of Student Services that you could fill in and put in a box, and we will make sure that they get to the GP practice for you if that is easier for you. But yeah, it's really straightforward to do your registration online, and they are very busy at the moment. So if you are looking for an appointment, you need to be quite persistent to get one, but before you do that, you need to be registered. You can stay registered with your own home practice as well as you're a student, and I think at this time and place, it's probably a good thing to stay registered with your home practice as well as registering with the practice here, and that is perfectly fine as long as you're a student. You can do that, and that might just make it a little bit easier for you to access repeat prescriptions and things like that if you need to do that. And I think that is probably all from me in terms of the student services and the services we offer. If you have any questions, come in and talk to us. As I said, the reception is open 10 to 2 from next week. And also check up on the website and the student services, and you can read a bit more about the service we provide. I do urge you to get in touch with us if you have questions. And you can have appointments with us both face-to-face and online. And it's completely up to you what you choose to do. But I do think it's important. Some people just really need to see a person in reality. And I think for those people, there is definitely face-to-face appointments available. So I do urge you to get in touch. And I think I'm handing on to the Students' Union.
Thank you very much. Hello, everyone. I hope you can hear me fine. I am Chiara. I'm the student president here at QMU. So I work at the Students' Union, and the Students' Union is an organization that is run by students for students. So essentially, we're here to make the student experience the best it can be for QMU students. So I'm the president of the Students' Union. I'm here with Andy, who's the vice president, who'll talk a bit more about his remit later. We also work with a team of part-time officers, so they're current students and they help us in various areas. So there's a postgraduate officer, a communities officer, a sports officer, and so on. You can see them all on screen. We're all here to sort of tackle issues that affect the whole student body and to find a solution for them, but also to just come up with ways to improve the student experience in general. We look for feedback from students to do this. So we run forums and committees throughout the year. We have the Academic Council, which is the class rep forum. So all class reps come together with myself, the student president, to kind of tackle common issues among the student population, to share good practice and useful things for the student experience. We also have other forums, but we always look for feedback from the student population in general because we're just a few people. We can't know everything that goes on in student life. So if you ever need anything, we are here for you, and we can help you, address any issue that you might encounter, or share good feedback, share good practice. In terms of support, we focus on academic support. So if you ever have any issues with any assignments, or it might even be a lecture, you can come to us and we can give you confidential advice that is independent from the university. We obviously work very closely with the university as a students' union, but we are an independent charity. So sometimes it's nice to have kind of objective feedback and advice. We offer other services that you can see on screen. We also have a website, you'll see it at the end, and that lists all of our services. But really, if there is anything that you struggle with, that you're not sure about, that you have questions about, as you've heard from Jessica and Richard, QMU is a very welcoming place. So just talk to anyone, come talk to the Students' Union if you want, and we can give you advice or direct you in the best person to answer your question. I'll pass it over to Andy, who'll talk a bit about sports and societies.
Yeah, thank you, Chiara. Good morning, everybody. So as Chiara said, I'm Vice President, so my role focuses on student activities, sports and societies, things like that. Obviously, this year has been challenging in a number of different ways, but we've got over 40 different diverse sports and societies that are open for students to join. Obviously, throughout semester one and over last summer, we had to adapt a wee bit. We're really happy with how the semester went. Kind of looking back now, many of our societies moved to online activity. The sports teams that were able to run and able to train put kind of adequate health and safety and COVID secure measures in place where possible, meaning that when the guidance allowed it, we were able to take advantage of it and get as much going as we possibly could. So obviously we're starting in a challenging position, but again, we're adopting the same policy that, and when we're able to do any form of activity, we'll be getting it on as long as it's safe, because obviously that's the paramount thing. The biggest benefit, I suppose, I want to try and convey, and if most of you are postgrads, you may know this already, but the most important benefit of joining a sports society is the kind of positive impact it can have on physical and mental health and well-being as well, particularly at a time like this. Student life has got its challenges, and these can be remedied through just opportunities to meet friends, like-minded people, and kind of chances to get active and reduce stress associated with university as well. So as postgrads or undergrads, sports and societies are open to every matriculated student at Queen Margaret. we would all love to have you involved. I hope from everyone you've heard from, we are quite a welcoming kind of community. I really think you'll be kind of pleasantly surprised by the kind of community spirit that you get here. I know it's a cliche, but it is true. From this moment onwards, you're a member of that community. So we're all here to kind of help you make the most of that. So yeah, as Chiara said, and as you've heard already, we're here. Whatever problem you may have, just our contact details are all there. Please just get in touch, and if it's not something we can help directly with, we can in pretty much every case signpost you to the right kind of person or department to help. So yes, I think we're opening up for questions, not just to Chiara and myself, but to Jessica or Richard as well. So I think the chat function should be open if anyone's got any questions.
Yeah, thanks very much, Andy, Chiara, and Jessica. So as Andy says, if you've got any questions, you can kind of type them into the chat. I mean, I appreciate there's about 160 of you on the call, so you may have to get in quickly. But if you do have any kind of sort of pressing general questions, then we'll endeavour to answer them. I mean, you'll be aware that your induction schedule, no other aspects of the induction have started for some people already. Includes program-specific information, and you'll get so if you've got program-specific questions, they're probably best directed there. So a question for Andy, it looks like, in terms of where can students find more information about societies?
Yeah, so our website is just on screen if the slides are still showing. That's qmusu.org.uk. There's a full list of all of our sports and societies there. In relation to if they're meeting at the minute, obviously in-person meetings aren't permitted, but as I said, a lot of them are moving and transferring online. So when the semester kicks off over the next couple of weeks, they'll be resuming that online activity for now as well.
Thanks, Andy. If we don't know the answer to any questions or don't get the chance to answer any questions you post in the chat, what we will do is we can issue something to you that is effectively a kind of sort of frequently asked question thing. So into this question here regarding the on-campus COVID testing, let's just disappear off my screen. Is this available to international students who are currently doing a quarantine on campus? Whether you should wait. I should say that the testing is going to continue, at least into February, so there's plenty of time. So I think probably my advice for now, unless we post something to the contrary, would be to wait until your quarantine period is over before going for a lateral flow test. But as I say, you'll have no problem getting a session because they'll be running, sort of right the way through February. Therapet on campus, Andy and Chiara we're a bit more sort of limited again because of being at level 4, but Andy and Chiara, I don't know if you can answer that one in terms of Rocco.
Yes, so our general manager, Kirsten, who should be on the call, owns Rocco, who is a Therapet, and they're on campus a few times a week. It's hard to predict it right now because of the restrictions, but yes, Rocco's a registered Therapet, so if he's in the office, he usually takes a walk around campus every once in a while, so you can see him and, pet him a little bit, I think, if it's allowed. Again, very hard. There's also Bo and Dixie. They're not Therapets, but they're also in the office every once in a while. So yes, there are Therapets on campus sometimes.
In terms of if you're sort of out of the region, as it were, and want to access the books in the library, we're not, as far as I'm aware, sort of posting books out. So they would be. It is more than being sort of available for collection. I should say that the online. I should say a couple of things, but a lot of the books are also available online, and the vast majority of the journals are also available online. In fact, there are more available online, than there are physically. But in addition to that, if there's any essential reading for your courses, what will normally happen is your tutors will upload that essential reading. It'll be sort of scanned under the kind of copyright license agreement that we have. It'll be scanned and made available on the Hub site, which is our virtual learning environment for the module in question. So you should have no problem, even if you can't come physically onto the campus, accessing a sort of both the kind of primary and secondary reading that's required for your program. Yeah, probably not. Jessica, there's a question about whether kind of QMU students kind of, sort of registered at QMU can register at practices other than Riverside GP practice.
Unfortunately not. Riverside is the practice. However, I think at the moment, I would encourage you to register with them. They have employed additional staff to manage the calls, because I think that was one of the big difficulties they have. Before Christmas, they did hire additional staff, which should have helped to some extent. I know there has been big problems. However, if you are already having a GP somewhere else in the UK, I would urge you to actually stay registered with them as well, because most GPs see patients online. So there's actually nothing to say that you couldn't see your home GP online. And I think in many cases that has kind of, people have kind of been doing a bit of both. And that has been working quite well, because when it comes to repeat prescriptions, either you can get somebody to pick it up for you, or you can get it hopefully sent to a pharmacy closer to you. So I think that might be an additional option, but no, you can't, unfortunately, you can't register with a different practice. We did ask that question earlier in the year. But if you're not living in Musselburgh, you can obviously register with wherever your closest practice is.
Thanks, Jessica. And I'll just try and speak up. It's not normally a problem. Greg, there's a question. I don't know if Greg, some of you have met from our his sort of the international office. There's a question about how international students go about getting a national insurance number.
Good morning, Richard. I'm not sure if you can hear me or not. I've got my camera off, or I'm actually in 2 calls at the one time. Multitasking. In terms of national insurance numbers, let me check up on that. I might be one more for our careers team, for Juan and his team to organise. That's normally something that we would kind of refer that in that direction, but we can certainly ask questions and maybe ask the careers team to make something a lot bit more public there for everyone's benefit. You do actually have to, sorry, Rich, you do have to physically be here. So Rachel, I'm not sure if you're here yet. I know Erica has arrived and a couple of other familiar names in the chat, but you do have to physically be in the UK before that's an option as well. So that's something that we can work with, and maybe just drop Juan an email or a quick message just to find out if we can. In fact, Jessica, thank you very much. If you contact careers, they can give you information about that. It might be something that's on their webpage already on the website. I can maybe have a look at that just now in the background.
Jessica, there's a question about if someone's already registered with a GP at home, is it absolutely necessary to register with one here? And I think the short answer is it's not absolutely necessary. However, it's strongly advised, because otherwise, if you do need to then access a GP while you're here, if you're not registered with one already, then essentially you have to report to accident and emergency, the casualty department at the hospital, which is not what you want to do. Jessica, is that correct? That
is correct. So I think it's definitely a good idea to register with a GP here as well. You might not end up using them, but I think just as Richard says, if it's an emergency and you need somebody to attend to you in terms of emergency, that would make more sense. We don't want to sort of, I think, particularly at the current time, we don't want to clog up accident and emergency more than absolutely necessary. So I would urge you to do so.
And we'll, I can see there was a question about the link to the IT induction. We'll get that checked out, and we can reissue a link if there's an issue with that link that you've received. There was another question as to whether asymptomatic testing will be available throughout the semester. That's a bit of an unknown, as I say, certainly at least sort of through February. And while we've still got students kind of coming, the sort of late arrivals, as it were, because of the sort of staggered start particularly for some of our non-health, non-creative sort of subjects, undergraduate students, or some of those undergraduate students won't really be returning on campus until end of February into March. Then testing will be available until then. But it's a kind of UK government NHS thing thing that we're part of. So we're really in their hands in terms of how long we have it available until. But I'm confident that we would continue to have it available while we still have students arriving on campus. Those of you who do go out on placement, there's testing as part of that as well. So you're kind of not just your arrival here, but also when you go out on placement, you'll be tested too. All right, I think that's it for questions. As I said, we'll follow up on a couple of them. So last chance for any, well, not really your last chance. You'll see we send out regular updates via what we call our kind of sort of moderator to sort of students if there are any changes, and usually if there are any changes to the Scottish Government guidelines, we will then, sort of within a day or two, normally by the end of the following day, because normally we have some sort of heads up if there are particular implications for universities. We'll issue a kind of sort of update to students in terms of the implications for you, if any, of those changes to Scottish Government guidance. So do check out particularly, at the moment, do keep an eye on your kind of, your university email inbox and on those moderator messages. They're also used, as you'll see, for providing information when we have kind of careers fairs, that sort of thing coming up. And you can see kind of Kirsten is sort of reinforcing that message for me. Thanks, Kirsten. And Nicola's provided a kind of fresh link to the IT induction in case for those of you who are asking about that. Thanks, Nicola. Right, Rhiannon, a question for you, Andy, in terms of sports activity insurance.
Sorry, yeah, thanks, Richard. Yeah, Rhiannon. Essentially, whichever sports society will have a tier of insurance associated with it. So, for example, high tier would go with kind of collision and contact sports like rugby. Low would go with societies, writers' society, things like that. So each sports society, when you sign up, has the attached tier of insurance that goes with it.
I'm not sure what the issue is there. What you can do, if you do have a problem with any IT, and this is true for everyone, then you can email assist, which is simply just check up, assist, ASSIST, at qmu.ac.uk. Greg's put the link up there. Thanks, Greg. And sort of, they'll be able to help you with your query. And that's true for any kind of, if you're having any kind of IT issues, accessing your account, accessing, sort of any of the kind of sort of, the software that we provide. Okay, I'm not seeing any other questions coming in. And as I say, you'll have plenty of opportunity to, as part of the induction, you'll all be, as everyone gets assigned, all students are assigned a personal academic tutor, and they're kind of like, if you're not sure who to go to, they're a useful first port. Your sort of, kind of program leader would explain, how to find out who your personal academic tutor is. When you do, and they're usually one of the tutors on your program, when you do, they're a useful person. If you've got a query, it might not be an academic query, but they'll be able to point you in the right direction, to signpost you in the right direction. We'll also be operating a reception desk in the library, in the LRC, where again they'll be able to point you in the right direction if you're unsure who to go to if you've got a particular query. And I think the key message from us, and I think kind of Jessica was alluding to this sort of earlier on, is don't hesitate to engage with us if you're not at all sure about something. If something's come up that means you're worried about kind of your progress on the course or your ability to to get an assignment in on time, etc. The earlier you contact someone, if you've got an issue or you think there might be an issue, you know, whether that's to do with your kind of, you know, your academic progression or your welfare or finances or whatever, the earlier you contact us, either through student services, your personal academic tutor, or through the student union, then really the better, and the more we can do to support you. So don't, you know, I think as Jessica was saying, don't be at all kind of, you know, backward in coming forward if you've got any kind of any queries, or you're kind of concerned about something. Plenty of people here to help you with that. And as I say, if you're worried about kind of, you know, approaching the right person, don't worry. You know, it's as both Jessica and Chiara were saying, we're a relatively small university, you know, sort of 5,500 students usually on campus, 2,500 or so with our kind of, you know, sort of overseas partners. And so we do have a reputation for being kind of, you know, friendly, supportive kind of community, and people will point you in the right direction if they're not the person to ask you your query. But as I say, your personal academic tutor is always a good port of call once you've once your program leader has explained how you can find out who they are, and similarly the kind of the sort of reception desk in the library, or as Jessica says, you can just email student services directly at that address. Most QMU addresses are fairly for individuals, you know, it's kind of, you know, your the first letter of your full name, your surname, and then at QMU, and you can see, you know, student services at qmu.ac.uk will get you there. Okay, that looks like it's that's us for now. Thanks very much for joining us this morning. I hope you have a fantastic time. As I say, look forward to sort of seeing you at some point or other during your kind of, you know, your academic journey. And yeah, enjoy the rest of your day and your time here at Queen Margaret University. Thanks.